Welcome to this edition of the First Aid Show. In this edition, we're going to have a look at trauma dressings. Here we have a selection of trauma dressings. Now you're familiar with the standard first aid dressings, the likes of the medium dressings, which are 15 centimeters by 15. These are designed for much larger injuries. They could be bomb blasts, amputations, or serious bleeds. They will absorb quite a lot of blood. The important thing when you're using dressings like this is also think about, do you need to use hemostatic agents? Do you need to use tourniquets? But the dressings themselves, they're all very similar in how they work, but the pads that are on the dressings are much bigger to cover larger areas. So what we're going to do now is have just a look at these selection we've got here and see how they look and how you use them. This is the first one we're going to have a look at. Now you see it's been shrink wrapped and it's airtight and it's sterile. It may look a bit odd when it's all shrink wrapped like that, but you can again tear these, or sometimes it's easiest just to cut it off. Once you cut it off, you'll be able to open it up and then remove it from the wrapper. Now this dressing here, you need to unwrap it to start with to see the size of the pad. Now that is the main pad that goes onto the wound. It's very large, it's very absorbent, and it's good for large areas. Now this type of dressing has actually got stretch in it. Now the advantage of a dressing like this is you can apply a lot of pressure on, so you have to deal with multiple casualties. You can apply this dressing on and then move on to the next injury or the next person. But it's important, if you do put a dressing like this on and it carries on bleeding, these dressings will hold a lot of blood. So you may well have stopped it for now, but is this just absorbing the blood and not actually stopping the wound from bleeding? So you need to revisit and make sure you don't forget someone. So with this type of dressing, you can apply that directly over, and then you can apply the pressure on. I'm just popping this into my hand, obviously wouldn't be a normal place for it. As you see, it's lots of stretch in the bandage. You can apply that on really tightly. So as that wraps round, you can, like now I can feel that very tight, so we can really apply, but be careful not to put so much pressure on, you then basically acts as a tourniquet. So you've got to make sure that you've got a pulse beyond the injury site. But this type of thing can go around arms, legs, or it can go around abdomen wounds, things like this. So with this type of dressing, it has a plastic clamp on it. So what you do with this is tuck it underneath the bandage and you can clamp it nice and tight so it's gripped onto it itself. Obviously I'm trying to do this one-handed on myself, and that's not really what it's designed for. Once you've tucked it underneath, you can clip it through, and there's a little catch on the end, and that will just lock in place. Once that's locked in place, the dressing stays there. But remember, this is a lot of absorbent power here, so make sure you have stopped the bleeding and that you haven't got to also use a tourniquet or hemostatic dressings. Now this type of dressing has got a very large pad on it and a conventional bandage. This sort of thing you could use on an abdomen wound where you've got to cover a large area. So you see when you open this up and look at the sheer size of the pad, it's much bigger for large areas. On here you have the bandages to hold it in place. They're just basic bandages. You're not really applying pressure like with others, but this would be a bandage that you could cover a large area with one dressing. Now this is the one that's called a military field dressing. Again, it comes shrink wrap packed. Here you've got the large pad on it, and you've got the bandage for securing it. And again, this is a stretching bandage, so you can apply a lot of pressure onto a wound. You can pop the pad on and then tie it off on this end, or you can just secure it with tape once you've actually put it on. But again, take care not to put it on so tight that you cut off all circulation. These are not designed to be used as a tourniquet, they're just to stop bleeding. And again, that's a very high absorbency pad, so make sure that you don't, you keep an eye on the patient to make sure that you're not losing lots of blood without realizing. Now this dressing is a standard ambulance dressing. They come in different sizes. This one's a number 3 ambulance dressing, and it works similar to the ones on conventional first aid, but as you can see, it's a much larger pad on it. Bandaging is there to hold it in place. It's not designed to apply loads of pressure, but you will, by just using that bandage, be applying pressure. But very large dressing on there, good for large areas. The last one we can look at is a blast bandage, and this one's a little bit different. As you unwrap it, you'll see clearly states on there which side goes against the wound, but it looks very large and bandage on the end. And the reason with this is you can use it around other injuries, but if you had a amputation, you could pop the dressing over and then you can just fold that around, and then the actual bandage would then go around this side so it can stretch. And again, it's a stretching bandage and it's gripping through, so you can actually bandage on an amputation and keep that in place. As you go see through, there's Velcro as you're working this through, so it does hold itself in place very nicely. You can apply good pressure throughout the injury site. Just when you get to the Velcro bit, just let that undo. And this, you can feel good pressure on the wound, so it's stopping any bleeding. So this can be useful for any injury that you're likely to come across in the sense of serious. And on the end here, you've got a standard clip, again with Velcro, so it holds it nicely tightly in place when you want to secure it in place onto the injury site.